Chasity Konen. Welcome everybody and thank you for coming. Today we're going to be talking about depression and how it affects the family. For many of us, the word depression is a taboo word. A lot of people don't say it out loud. In fact, suffering in silence seems to be how the majority of the population deals with depression. But the truth is that most of us will have a bout of depression or feeling down at some point in our lives. In fact, you may have experienced it already. Maybe you've been to a job interview, things didn't go the way you thought they did, and you moped around for days feeling low or down. And then your best buddy or your spouse came to cheer you up with your favorite pastime. This is considered a very mild case of depression, and with the help of friends and family, one is able to bounce back to the everyday functions of life. In the more extreme cases, the feelings of sadness and other symptoms such as withdrawal and social interactions, sleep disturbances, feeling sad, and having an irritable mood may be severe. This can happen after the death of a loved one, divorce, or a major change in life. When you leave here today, I want you to have a better understanding of depression, and I'm going to share with you my experience with depression, how it has affected my family, and the steps I've taken to help myself. First, let's learn about the cause of depression. There are some types of depression that run in families, such as bipolar disorder. Not every person with a genetic history of bipolar disorder will develop the illness. There are additional factors such as possible stressful events that is involved with the illness onset. Major depression also seems to happen in some families generation after generation. However, major depression can also occur with no family history of depression. And then finally, a hardship in a person's life, such as a loss, chronic illness, financial problems, a bad relationship, any unwelcome change in the life pattern can trigger the depressive episode. Here's a little family history about myself. My mother came from an abusive alcoholic family that was so bad her and her 10 brothers and sisters were separated and placed in foster care. She herself has been an alcoholic and drug abuser since she was 22 years old. Upon my parents' divorce, my mother has been on a downward spiral of alcoholism. And then my sister experienced divorce at the age of 8 with my parents' separation. She's always been withdrawn, and one minute she's happy and the next minute she's so angry she's hard to deal with. My sister started using cocaine and meth during her marriage. Both my mother and sister have been diagnosed with being bipolar, and both of their diagnoses came after they experienced divorce, and my sister tried to commit suicide. With that being said, I feel that my family has a history of bipolar disorder. And seeing my family go through this, I became familiar with the bipolar disorder and depression. Now here's where I fit into the equation. My husband and I had a business that was started to see hard times about 2 years ago during the start of the housing dilemma our country was experiencing. Because of that situation, we had to close our business, lay off 23 employees, and we found ourselves unemployed and facing bankruptcy. We had to move in with my sister and her family of 5, my mother and her boyfriend. So just imagine, a 3-bedroom house accommodated 11 people and 5 dogs. Yeah. You can imagine that was a very interesting situation. And then next came the long road of trying to find myself again. I went back to my old job as working as a CNA at the hospital. Having a job was great, but having to answer the same question to everybody over and over again became real old. There was no way for me to put it behind and start to move forward. I had to constantly relive the devastation of losing everything that I worked so hard to obtain. And I'm not just talking about material things, I'm talking about status in the community. People thought we were crooks and liars after this. I remember going into Home Depot and seeing people talk about me and feeling so ashamed. That wasn't the worst of it. My husband told me he had a job in Hawaii. He got the job and moved to Hawaii. He left 3 months before me and the kids, and that was my first encounter with what I would call a mental breakdown. I just couldn't function. I cried all the time. I was calling sick to work because I didn't want to be around people, and all I did was yell at our kids, who were 4 and 8 at the time. It was very hard not having my husband around for 3 months. I was struggling with life, and then my husband moves 2,500 miles away. It was just a little too much. I needed him to help me with the kids because I was doing a horrible job at being a mother. I was so involved in my misery that I just couldn't focus on the kids and what they were going through. I needed his help. Once we finally moved to Hawaii with him, things got worse. I was feeling very alone, and I cried most of the time. I had no family and no friends when we first moved here. Plus, I couldn't find a job, and the bills were mounting. When I did find a job, the work environment was horrible, and then we couldn't find a sitter for the kids. That was so hard, asking complete strangers to help keep an eye on the kids so I could go to work. The kids were having a hard time as well adjusting, and I still wasn't able to be there for them. My husband was the one who kept them grounded. It just seems like nothing can go right, and the more it goes wrong, the more withdrawn I've become. With all of this information, now let's take a look at how depression is diagnosed. An easy and very confidential way to find out if you should talk to your healthcare professional about depression is by taking a depression self-test, which asks about depressive symptoms. These tests are easily accessible online, and here's an example of one such test. And I actually took this test.
Thank you.
You're welcome. And you can find that test on discoveryhealth.queendom.com. This is only one way of beginning to see if a depressive order is happening. A thorough diagnostic evaluation from a primary care doctor is also another option. Primary care doctors usually use a questionnaire similar to the one that I just passed out to help identify people who have symptoms of depression. Questions such as when did the symptoms start and how long have they lasted? How severe are they, and have the symptoms occurred before, and if so, were they treated, and what was the treatment received? The doctor should also ask about the use of drugs and alcohol, and if the patient has ever thought of death or suicide. And another very important question is family history of depressive illness, treatment that was given, and the outcome for those family members. Now let's take a look at how to treat depressive issues. I want to take a moment to stress how important it is to seek help. Asking for help does not make one weak. In fact, asking for help is bold and a strong move towards one's own recovery. The important thing to remember about depression is that it is almost always treatable. There are many different types of treatment, which include medication and talking to a therapist, also known as psychotherapy. Medications such as antidepressants help with depression and often can take months before seeing any significant changes. There is also electroconvulsive therapy, also known as ECT. This is a procedure where an electric current passes through the brain to produce controlled convulsions or seizures. ECT is used for people who have not responded to antidepressants, they have severe depression, and are at high risk for suicide. ECT is highly effective, and results can be seen within 1 to 2 weeks after the treatments begin. Finally, there's psychotherapy. This approach is also known as the talking therapy. In this approach, the person will gain insight into the problems and resolve them by talking with the therapist. This is the approach I am taking with my own battle with depression. In fact, my first appointment with a psychologist is next week. For me, talking is very therapeutic, and I'm looking forward to gaining valuable insight into my underlying problems and finding a way to resolve them so I can get my happiness back. In fact, my 5-year-old son just a few nights ago told me that he misses his mommy that laughed and played with him. He went on to say that I love you, mommy, but I want my happy mommy back. Talk about an incentive to want to get better. As you can see, depression is real, and it not only affects the one that's going through it, but it affects loved ones as well. I'd like to thank you for taking the time to be here with me today. And if you have any questions, we can follow up after the presentation. Thank you. Where am I at in time?